Let's be honest, modern medicine is broken. Patients are dismissed, doctors are exhausted, and mental health care is decades behind. So it's time to disrupt the status quo, to challenge a system that fragments care, dehumanizes patients, and burns out clinicians. I'm Dr. Georgine Nanos, and this is The Kind Revolution, a podcast about breaking old paradigms, rebuilding medicine with compassion and science, and reimagining what healthcare can be when we finally get it right. Because change is here and it's starting with us. Welcome to the revolution. Welcome back to the Kind Revolution podcast. I'm your host, Dr. Georgine Nanos, and today we're diving into the world of integrative and regenerative medicine with a very special guest, Dr. Erica Oberg. Dr. Oberg is a naturopathic doctor, researcher, and thought leader with more than 20 years of experience helping people achieve vibrant health, longevity, and vitality. She's the founder of Concierge Natural Medicine in La Jolla, the medical director of Marquis Medical, and the upcoming author of Healthy Hedonism, the Pleasure Prescription. I'm excited to hear about that. Her career spans clinical practice, medical education, NIH-funded research, and she's published over 30 peer-reviewed research papers on topics such as integrative nutrition, vitamin D, diabetes, also a sought-after international speaker sharing her expertise at wellness retreats around the world. Dr. Oberg is passionate about empowering people to thrive at any stage of life, even during illness, stress, or transitions. And today she's here to share how natural medicine, hormones, and advanced diagnostics can help reclaim control of our health. Thank you so much, Erica. I'm so excited to have this conversation with you.
Well, thank you for inviting me here, Georgine. I'm looking forward to talking with you.
Yeah, me too. And you and I have talked a lot and we've shared a lot of mutual patients and seen people through some very trying times. So let's kind of go back to sort of your origin story. What inspired you to become a naturopathic doctor and devote your career to integrative medicine?
Yeah, it's been quite a journey. I started naturopathic medical school in '09. Prior to that, I actually didn't think I was interested in healthcare at all. My undergrad degree was in anthropology, and I was working for the Seattle Opera at the time as the house manager there. And I thought my career was going to be in arts. And although I'm still very passionate about the arts, I found as I was working in those positions that I really was looking for something a little bit more meaningful in life than where somebody's seats are for the season. You know, it felt like there's got to be something a little bit more important. And I'd always been passionate about just health. I grew up with a very healthy food oriented mother. I worked in a little nutrition health food store for a while in college. And while I was just kind of dabbling around, wondering like, what could I possibly do that could be more interesting than arts management? A friend introduced me to Bastyr University.
You've worked across clinical practice, research, and education. How have those different experiences shaped your approach to patient care?
I think really especially important in integrative medicine because often we're helping patients make decisions about cutting edge therapies, right? Stuff that might not yet be FDA approved. It might have some research, but maybe not, as many trials as we wish it had. And so I feel like the research skills that I learned in the 10 years of running clinical trials after that really helped me take a critical eye at sort of the emerging science in integrative medicine and help patients make informed choices about whether they should be experimenting with something new and cutting edge or whether we should turn to something more traditional and wait for more data.
Yeah, oh, that's such a great background to have and to integrate into your practice. You know, one of the things that is I see so commonly today in my practice and generally in medicine with patients is they feel like they can only exist in one world or the other, in the world of natural medicine or in traditional medicine. And I think that makes both of us sad because the integration of the two and bridging that gap is so important to me, and I think it's important to you too. Can you talk a little bit about that and what that would look like in an ideal world to you?
Yeah, absolutely. I mean, I think podcasts like this are exactly, where we're hoping the future is going, right? These types of
Yes.
conversations and this type of integration. But I mean, I've always practiced with MDs, with medical doctors, and sometimes I joke that, I'm bilingual in traditional and conventional medicine, natural medicine, pharmaceutical medicine, whichever two flavors people want to call it. And I think it's super important, right? We've got all these tools in the toolbox. And why, on either side of the fence, why would we only use half the tools in the toolbox? There's a
Right.
time and a place for everything. I prescribe pharmaceutical drugs when that's the right thing, send people to surgeons and specialists when that's the right thing. And sometimes, we'll tell them to have a cup of tea and go to bed.
Right.
Sometimes
Yes,
simple
exactly.
things work too, and
Right.
everything in between. But
Yeah.
I do think everybody, we need more integrative access to integrative medicine, and we need to integrate it into hospital systems and places where lower force, lower cost often options can be used hand in hand with some of our most sophisticated life-saving technology.
I could not agree more. I absolutely could not agree more. And I think it's important for people to realize it's not an either or world. You can do both. They can work together. Finding practitioners that can help you bridge that gap is important for people to seek out. Let's talk about thriving at any stage of life, which you often say, even in the midst of chronic illness or stress. Can you share what that looks like and maybe some examples?
Sure, yeah. I mean, it is, I think, what I am most passionate about is really helping people, find a sense of thriving, not just getting by, not just managing their diabetes, but truly, getting better, feeling well, having more energy, having more positivity, having, a better outlook on things. And it can happen at any point. I mean, I think back to one of the more beautiful moments with a patient of mine who passed away in his 80s. But over the last couple weeks, he had a gallbladder issue that turned into a blockage and a sepsis and such. And so he was discharged home on hospice. And over those last couple weeks, so much thriving and healing happened as he was able to, not focus on all of the doctor's appointments and all of the medications that had been occupying the years previously. And his friends and the family were all able to come together and be with him and sing with him. And I saw him the day before he passed away with a house call. And I was there right at sunset, and he just was watching the sunset and exclaiming on what a beautiful evening it was. And he couldn't be happier to be there. And, that's thriving, being able
Uh,
to enjoy a sunset, on your last day.
it's
So
so beautiful.
it can be that. Sometimes it's simple. Sometimes it's, giving a really tired postpartum woman permission to sleep in and stay in bed and, encouraging her, yeah, you really need to let your husband take the kid for the whole morning, not just 15 minutes, but the whole morning
Yeah.
so that you can sleep. Right. And that can be an example of thriving. So it can happen, in so many different scenarios.
Yeah, so true. So, a lot of our listeners, especially women, feel disempowered in their current healthcare experience. What advice do you have for someone who wants to take back control of their health?
Yeah, it's so common, isn't it? I feel like that's the story that almost every woman I see these days leads with is just their frustration of, being told that their labs are all fine, right?
Hmm.
Or, that it's just, you're just getting old,
Yep.
you're getting older, suck it up. Or
Normal
like,
aging, just deal. Yeah,
yeah,
exactly.
no, it's such a disempower, the degenerative conditions. I have a patient with a pretty new diagnosis of MS, and the neurologist I sent her to, it just was just terrible. It's like, oh, this is just going to be terrible. You're just going to, decline and decline and decline, and I'll give you some drugs, and they're not going to work for very long. It's like, just, I mean, whether that's true or not, there's a lot of different ways to deliver that message.
Absolutely. Yeah.
I think what people need is, doctors like you and me, right? They need somebody
Yeah.
who's going to help them be empowered and ask the right questions. Honestly, it's also what we do at Marquis Medical. which is an AI startup that for which I'm the medical director. But we generate these very, very detailed longevity reports that look at everybody, your past medical records, whether it's 10,000 pages or however long, and distill out some recommendations and questions to ask your physician, right? Which I think can be a very empowering place to start, not just, signing up for whatever you've been told about your diagnosis, but really asking some questions, asking for a second opinion, asking if there's, referrals in the integrative medicine world that might be appropriate. And then
Yeah.
people have to do their own homework, find people like you and I, through their
Yeah.
internet searching and online.
Yeah, it's so true. It's just advocating for yourself is the key, and is I think that's important for everyone, but I think women especially sometimes have a hard time. They're putting everyone else ahead of themselves, and
Yeah.
we have to remember that. Yeah, that's important. So let's talk about hormones. I know hormone health is a really big part of your work and mine. What are some of the common myths and misunderstandings about hormones that you would love to dispel?
Yeah, there's so many. I mean, the party line about the timeline of hormones, I think, is maybe a good place to start, right? This idea that it's too early or too late to have that conversation about hormones. So, I'm certified by the North American Menopause Society. I'm sure you are too, right? It's the national organization that, represents the guidelines and the state of the science. And, they're still on the conservative side, saying that there is no room for that conversation after 10 years after menopause. Right. And at the same time, saying that there's no room for a conversation about bioidentical hormones until it's been 6 months since you've had your last period. Right. And it's just women,
Yeah.
there's so much suffering happening on either sides of that narrow little time window of, early menopause. So I
Yeah,
think
and there's so much
that's a myth.
nuance. Totally. And there's so much nuance in every individual experience. But yes, that's one myth. Give me some more.
That all hormones are created equal. That's a myth. There is both, pretty clear scientific evidence that the risks and benefits of bioidentical hormones are different from that from conjugated equine estrogens and progestins, very different from estradiol and progesterone. So we've got
Yeah.
very conclusive scientific research supporting that, and yet that nuance is often dismissed. So that's a myth I think we should get rid of.
Yeah. So when a woman comes to you in middle age, midlife, what's your approach? She comes into you, she's been seen by her primary care doctor who has dismissed her and said, hey, it's normal, it's midlife stuff, just deal, your labs are fine, you'll be fine, get over it. What's your next? Where do you take it from there?
Yeah, well, I've actually put it together into a 90-day program that we call Getting Started with Hormones. And it's not always hormones. Sometimes it might be botanical medicines, or, other non-hormonal treatment options. But it's a 90-day program. And our approach is to start with a in-depth one-on-one consultation, really understand, not just your hormonal goals, but your holistic big picture goals. And then I have a system where we teach women all of the signs of excess and deficiency specific to estrogen, progesterone, cortisol, testosterone, so that they can really start to develop that self-awareness of what hormone some of their symptoms might be associated with. And then if we are starting women on bioidentical hormones, I have a system where we start at a low dose and we titrate up gradually week by week, watching those symptoms of excess and deficiency until we get to that sweet spot when everything feels great. And usually we find that because we went a little too much and then we had some symptoms of excess and then come right back down. And once we're at that subjective sweet spot, I like to run some testing so that we can also look at the lab data and some objective information as well as the subjective, I feel great, I'm thriving, but the objective lab test, because I want to make sure of two things, make sure women are metabolizing and detoxing hormones appropriately, and honestly, that they're getting enough, right? If we're using bioidentical hormones to prevent osteoporosis or dementia or heart disease, those are the three that have the best data in terms of preventive benefits beyond quality of life. Like, I want to make sure that they're actually getting enough to protect their bones So we kind of go through this program to kind of get women started and hold their hands. And my health coach does a handful of sessions with them to, change eating habits and change, you know, exercise routines and all the other things that you kind of need to do, through that transition in life.
Yeah,
So,
that's great. It's a very
yeah.
comprehensive approach. I love it.
Yeah, we get a lot of real positive feedback on it. I think it's, it's a confusing time. And I'm
Yeah,
sure you hear this all the time. Women come in, I'm doing exactly what I've been doing for the last 10 years and it's not working anymore.
right.
And that's because you need to do different things pretty much every
Exactly.
decade.
Yeah.
So this program kind of walks them through it.
Nice. Let's talk a little bit about peptides. This is,
Mm.
other than the GLPs, I don't have a lot of experience in this area. And I'm dying to learn more from you on what exactly they are, which ones we should incorporate, what they mean. I know there's hundreds and hundreds out there, but what are your go?
Yeah, the peptides are definitely kind of the wild west of integrative medicine right now. They're getting a lot of attention, and some for good reason. I mean, some like the GLP ones, right, have now come out of the world of unregulated peptides into the world of, FDA approved pharmaceutical companies. And we see that kind of gradually, not just in the space of peptides, but with, some other natural agents as well. But with peptides are very small proteins. Some of them are bioidentical. Many of them are actually synthetic. They're not particularly natural medicines, but they are designed to interact with particular receptors in our bodies to stimulate the body to do one of its own processes more successfully. So, for example, probably my absolute favorite peptide, they all have funny names. They are all like letters and numbers, but my favorite one is called BPC 157, and it stands for Body Protecting Compound. I don't know what 157 is all about, but it's an amazing peptide that stimulates tissue repair and healing. And I find that it is useful in like every orthopedic situation, arthritis. It can be useful for like gastritis, pretty much any itis, right? All of those sources of inflammation that underlie so many different conditions that we deal with as doctors, but also, that are related to pain. And pain is often what's limiting people from living their best lives. And so BPC 157 is I think, very safe and very powerful peptide to help people, stimulate healing and tissue repair and be able to, say, be more active because the knees don't hurt anymore, or, be able to manage until that hip replacement is reasonable, to do in a year, or similar things like that. So that's one peptide that I'm pretty excited about. What peptides do your patients ask about peptides? Are there particular ones that come up?
They do. In fact, someone just yesterday asked me about KPV and GHK, and I didn't have a good answer. So, what are your thoughts on those?
Yeah, GHK it's a copper peptide, and that one's also in the press a lot because it does fabulous things for like wrinkles, for your skin health. It's also a tissue repair peptide, but it has a little bit more of a affinity for like epithelial cells and such, as opposed to, like for muscle and tendon tissues. But yeah, the copper peptides are powerful and they can be put topically in like skincare products that do seem like they
Is
work
it
pretty well.
is it similar to glutathione?
Not at all. Nope. I don't know off the top of my head what the GHK stands for, but it's attached to a copper molecule and it has an affinity for stimulating, yeah, skin repair and skin healing. So less wrinkles, better collagen turnover, more collagen production. Yeah, I've had a handful of patients play with it.
PV, do you know that one?
Yeah, that one is more, it's going to have more of an immune effect. So it's going to help
Got it.
stimulate the immune system. So there's also some thymosin two peptides that work with the thymus gland, and those ones are great for immune support. So those ones might be appropriate like before a trip, somebody who's prone to always getting sick when they get on a plane, or
Right.
cold and flu season, or that first week or two when the kids are back to school and everybody's getting sick. So those immune support peptides can be really helpful from that perspective for prevention. And then, in select cases, they can be useful for immune support in like autoimmune conditions or, certain cancers and things like that. But that's going to be a much more nuanced individual prescription.
So I guess one question for me is there's so many different peptides out there, and when there's lots of buzz on social media and then in the news, and how do you decide what to use? I mean, there's like
Yeah.
hundreds. So like how do you tease it all out for patients? Even for myself, I don't know much about peptides. I wouldn't know what to look at first. So like how do you do that?
Yeah, it's been a big process for me as well. I think I went to my first peptide focused medical conference in probably 2020. And so I've been learning about these for a long time and continue to learn. I think the first thing people should be aware of is that you got to know where your peptides are coming from, right? There's a
The
lot
sourcing,
of,
yeah.
because they're not regulated by the FDA. And so, people can buy them directly online and they might be from China and they might have contaminants and various other things. And most of these are injectables, right? They are subcutaneous injectables. So at least I am never going to inject something into my body that might be contaminated and may or may not be
Right.
what it says it is from China. So I think it's important that patients be very cautious about directly ordering peptides for themselves online. We source from American, what would you call them? I guess compounding pharmacies,
Yeah.
pharmaceutical distributors that have certificates of analysis that are analyzed in the United States that guarantee purity and potency and lack of, contaminants and things like that. So that's probably the most important thing, I think, before people start playing with peptides. And I recommend probably about a dozen of them. There are a lot. And last year I spent a lot of times combing through the research and putting together some nice monographs with research citations and comparing dosing, in this trial versus that trial, this influencer's website versus that one, to really try to come
Oh,
up
that
with
would
like some scientific. I'll share them with you. I'll send you
that would be
some of my
great. And
monographs.
we can attach them to these notes because I think that'd be so helpful for people. So you said you have a top 10 or 12. Can you share those with us? Because I'm dying to know.
Yeah, I mean, so the BPC 157 and the healing space, the GHK-Cu, the copper peptide for the aesthetic space. There's a bunch in kind of the growth hormone mimetic space that are really helpful for body composition. Usually my first go-to is one called CJC 1290. This is another example of a peptide that's crossed over into the FDA approved drug space, but Semarelin is used for lipodystrophy in HIV patients. Remember back with the old
Yep.
antiretrovirals, people would get fat in weird places.
Mm-hmm.
So there's a whole class of peptides like that that help the body with lipolysis and moving fat around. So those ones are very popular, like after the GLP ones, if there's still stubborn spots or for people that didn't respond well to the GLP ones. Some of those that operate in the growth hormone mimetic space can be helpful for body composition and dialing in the fat muscle ratio a little bit more specifically. None of those are going to work without exercise though, right? They're going to
Right.
augment the efforts of your workout. They're not going to give you muscle and melt fat while you just sit on the couch.
Eating donuts.
No, probably not going to work very well. So yeah, so those ones, I mean, the GLP ones obviously are effective and popular. We do a lot of microdosing with those,
Mm-hmm.
which a lot of patients like. I bet you do that too.
Yep. Yep.
And let's see what other categories. We talked about the immune support ones. The thymosin alpha and thymosin beta have slightly different functions, but those ones are probably good ones to have in your preliminary toolkit. And then there's some for sexual function. I haven't had patients report really great stuff with those, but I'm sure that there are some people that get good responses with those. I tend to go more in the direction of hormones when people have challenges with sexual function and orgasm and things like that. But there are peptides for those as well, but that's not really my area of expertise.
Okay. What about for neural health, mental health? Do
Yeah.
you use BDNF at all? I know there's some controversy on its efficacy as a peptide synthetically.
Yeah, I don't have any experience with that one. But there's cerebrolysin, which I have used like post-stroke, neurodegenerative conditions. I've used it like, for brain fog post chemo, and that's another example. So cerebrolysin is available as a pharmaceutical in Europe and is routinely given in the hospitals post stroke. So that one has a pretty potent and well researched effect on neuroregeneration. So that one's pretty powerful. And then there's like CMAX and C-Lank. CMAX is pretty good for like anxiety. That one might fit really nicely into a mental health practice. Sometimes those two are combined, C-Link and CMAX, with a little bit of like a regenerative effect, regenerative effect plus an anxiolytic effect. So that can be a nice,
Interesting. Very cool.
yeah.
I have learned so much in the last few minutes. That's incredible. Thank you. And I would love to have all those. We're going to put all those monographs on the show notes so that other
Sure
people
thing.
and so that we can all research look at them as well. So that's super helpful. Let's talk a little bit about healthy hedonism. I want to hear more about that.
Yeah, yeah, so this is my upcoming book. It should be out at the beginning of the year. And, I don't think people are going to find anything particularly earth shaking in terms of recommendations for, health and longevity. But what I hope people do come away with from the book is permission for pleasure. I think our culture comes out of such especially, the being healthy culture, comes out of this place of like, oh, well, if I just cut out that last cookie, or if I just push myself harder at the gym, or if I just, deprive myself more, I'll be healthier. And this book is all about debunking that and
Oh,
learning
I
to
love it.
use.
I love it already. That's
Aw,
perfect.
yeah, it's about learning to understand and pay attention to what feels good, as your guiding principle to finding what is good for you. And so with that comes some nuances of, understanding the difference between like excess dopamine, right, and some unhealthy, pleasurable habits like over drinking or, things like that. But really, if people tune into what truly feels good at a sustainable level, it almost always, I think it does always move us in the right direction of things that are good for us and will help us live longer lives and help us enjoy those long lives even more on a day to day basis.
Love that. That rings so true. So, for our listeners who feel overwhelmed in life with all the chaos happening in everyone's life, what's one small change they can make today to start thriving?
Yeah. Gosh, I think sleep is just so important. And yeah, and it's not a simple one thing. But trying to improve the quality of your sleep, I think, is a huge thing. So, some people do really well with like their trackers, their Aura rings, or their, Apple
Yeah,
watches, so that they can get some data on that. Most people are on their devices, too close to bed, whether it's the TV or the phone or the Kindle or the iPad. But those blue light habits, dark rooms, fresh air, and then, the sleep aids as needed, whether that's listening to a guided meditation or listening to a yoga nidra or taking melatonin or, double strength sleepy time tea or, Ambien sometimes, like all the tools in the toolbox sometimes, right?
yeah,
But I
yeah.
think,
Oh,
poor quality sleep and not enough sleep is probably the biggest epidemic that's keeping us from thriving.
very, very true. Yeah, I couldn't agree more with that. That's a great tip. So, looking ahead, you've spoken around the world at retreats and wellness centers. You have an upcoming retreat at Rancho La Puerta in 2026. Do you want to share some details about that?
Yeah, sure. I'd love to share some details about that. I actually was just there over the weekend, and I had dinner with Deborah Zeke, who is the founder of Rancho La Puerta, at 103. She is
Oh
103,
my
and
gosh,
we had a totally engaging, amazing conversation. She is 100% there. So she is the
that's
model
incredible.
of living well and
And
thriving at
thriving, right?
103.
Wow.
So when I'm there, I'm usually there once or twice a year. If you haven't been there, or your audience hasn't been there, it is the original health resort. It's been around
Yep.
for over 85 years. It's right across the border from us here in San Diego in Tecate, Mexico. It is a absolutely gorgeous property with flowers and woods and gardens and undeveloped mountains that we hike in the morning and amazing vegetarian pescatarian food and all sorts of different health and fitness classes, from lectures which I do on nutrition topics, metabolism, better brains, anti-aging, etc. Or you can meditate, you can go to sound healing, you can do circuit training, you could go to yoga. You can do nothing and lie by the pools. It's a wonderful place to reset and restore. And I will be there in 2026 in March. So people can just look up Rancho La Puerta and search for my name and find that week. And I invite you all to come and join me. It's a wonderful restorative week and just such a great way to take care of yourself and prioritize yourself for a week.
That sounds divine. I'm going to try
Yeah,
to come. It
you
sounds
should
so
come with
good.
me, Georgine. You'd love
I would
it.
love
Definitely. Have
that.
you been there before?
I have never been. I mean, I've heard so much about it over the years, but I have never been. But I think I might look into it because that sounds really, really lovely.
It's so nice.
Yeah. So, in closing, what excites you most about the future of medicine and the health revolution you're part of? What are you looking forward to?
Yeah, I mean, I think we're on a pretty nice, well, part of the healthcare system is on a nice trajectory. I mean, I think back 25 years ago when I was graduating, my grandmother came to my graduation from naturopathic medical school, and she was talking to me about how great it was on how I was taking care of the trees. And I was a little confused. And then I realized she thought I was an arborist, like my own grandmother. So, a natural doctor, right? I must take care of the trees. So I think we've come a
Oh my
long
God.
way in 25 years, that at least, people know what a naturopath is, and integrative medicine is not snake oil anymore. There's ample research studies. People are appreciating the importance of lifestyle medicine and self-care and less invasive approaches, less chemical based approaches. So I think we're heading in the right direction. I mean, I think what I would love to see more in medicine is actually like a return to more like good old small town family docs, practices like yours and mine. I think we can do so much more good when we take care of a small population and know our patients, personally and intimately. It's the kind of
Yeah.
care everybody should get. I had a patient come in, a new patient, she filled out her intake paperwork, and there's a section for like, who are your other healthcare providers in case we need to send notes or whatever. She said, my doctor has a 1-800 number. This is not healthcare. This is why I am here,
Oh
right?
God.
And
Yeah.
so I would like to see, a turn away from the corporatization of medicine back towards, a more personalized relationship with whoever your doctor is and whatever their
Yeah.
specialty is.
I would love to see that too. I don't know if we're going to get there, but I'm hoping. I'm hopeful.
Yeah.
Well, thank you so much, Dr. Oberg. Thank you for joining us today, sharing all of your wisdom. I know our audience is going to love this. For those of you who want to learn more about Dr. Erica Oberg's work, you can find her at drericaoberg.com or connect with her on LinkedIn. And then keep an eye out for her book, Healthy Hedonism, coming out in this year, right? In 2025.
Yep. Should be at the
And
end of the
then
year.
and then her retreat, Rancho La Puerta, in March 2026. And thank you so much for listening to the Kind Revolution podcast. I'm Dr. Georgine Nanos, and I'll see you next time. And again, thank you so much, Erica. It's been such a pleasure today.
Thank you, Dr. Nanos. It has been a pleasure. I've enjoyed it very much.
Thanks for joining the Kind Revolution. If this gave you something real, hope, perspective, or a fresh way to think about health, please share it, subscribe, and pass it on. Medicine won't change on its own, but together we can reimagine it and build something smarter, kinder, and create a system that truly heals. This is the Kind Revolution with Dr. Nanos, where science meets compassion and the future of medicine gets brighter one conversation at a time. Thanks for joining the revolution.